The United States is turning a corner in the battle against coronavirus. That's the declaration from a leading infectious disease expert today, the usually quite cautious epidemiologist Michael Osterholm, telling CNN this afternoon, while there remains work to do to prevent localized COVID outbreaks, the U.S., he says, should be celebrating the progress made so far with vaccinations. Now, one of the reasons for his optimism, record lows in the United States and the average of new daily cases, the lowest level since October. COVID hospitalizations, a low we haven't seen consistently since last fall. And daily deaths from the virus, still tragically high, 776 deaths yesterday, but deaths have fallen to the lowest average since July of 2020. For context, there was a day just in January where we lost more than 5 times that number of Americans to the virus in one day, more than 4,000 in one day. Today, we're also learning more about possible COVID vaccine boosters, with the president of Moderna saying he expects a booster shot will be needed every 9 to 12 months to protect against new variants, as CNN's Nick Watt reports.
His name is Alexander Hamilton.
Broadway tickets back on sale today. Cruises almost back, trial voyages with volunteer vaccinated passengers, and kids from Jersey can soon play basketball out of state again.
Things are only going to get better over the summer. I feel extremely optimistic about where we're headed.
The COVID-19 daily infection rate across this country, lowest it's been in 7 months. And
the models projected a sharp decline in cases by July 2021, and an even faster decline if more people get vaccinated sooner.
Vaccinations, the only number going the wrong way right now. Average daily doses in arms down 20% in a week. The president's goal, at least 1 dose in 70% of adults by 4th of July. Some states already there, a few getting close, some a long way to go. Republicans are most hesitant. But look at this new poll. The percentage of Republicans who say never is falling.
We've encouraged particularly primary care doctors, but all physicians in the state to personally reach out to people that they have a relationship with and try to make the case for getting vaccinated.
Kim Simmons of Illinois was hesitant, now fully vaccinated.
I don't think it would be good to try to force people to get the vaccine, but I think they should think about their family, their community, and herd immunity.
I'd say immunize at least another 80 million to 100 million people, and then when next winter comes, it will just be a bump instead of a surge. So, and we can do that.
July 4th, we can probably gather to celebrate independence from the pesky Brits, but not quite independence from this virus. Now, the new frontier, the next frontier is going to be vaccinating younger teenagers. Today, Moderna said in early results from trials, their vaccine is 96% effective in teens and no serious safety concerns. We are also waiting for the FDA to greenlight Pfizer's vaccine in younger people. If they do, then that CDC advisory committee meets next Wednesday to talk giving the Pfizer vaccine to 12 to 15-year-olds. Jake?
Those pesky Brits, eh? Nick Watt, thanks so much. Appreciate your time. Joining us now to discuss is Dr. Megan Ranney, an associate professor of emergency medicine at Brown University. Dr. Ranney, thanks for joining us. The numbers certainly look encouraging. The lowest average of daily cases, hospitalizations, and deaths in months. Do you think we have turned a corner in the U.S., or is it still too early to say?
So we have absolutely turned one corner, Jake. We have the vast majority of older adults are fully vaccinated. We have seen a dramatic drop in hospitalizations and deaths among that age group. I do not think that we will ever see the kinds of hospitalizations and deaths again that we saw this past winter. So we have turned one corner, but we have not yet eradicated this virus. We are still seeing younger people under age 65 who are getting infected, hospitalized, and dying. And because we have not yet gotten those vaccines out to the majority of Americans, much less to the globe, we're still seeing new variants emerge and spread among our population. And that, to me, is the wild card, as Dr. Walensky said, that we can't yet fully predict is how much will those variants spread and change our deaths in the year to come.
So as you note, the U.S. still recorded 776 COVID deaths yesterday, and that number is only worth celebrating in the context of the 4,000 a day we hit in January, but it's still way too many. Is that the new normal, hundreds of deaths every day? Should we expect to lose hundreds of people to COVID a day for the foreseeable future?
So if we keep getting vaccines out at the rate that we have been, no. By summer, we are going to be looking at maybe 100 or 200 deaths a day. There was a recent prediction out from the CDC saying that by September, we could be at a dozen or 24 deaths a day. But that is predicated on the fact that people keep showing up to get shots in arms.
So it's interesting. So many people who are in the vulnerable categories, especially people, Americans 65 and older, have been vaccinated. So who are the people who are dying from coronavirus these days?
The vast majority of deaths right now are in the 18 to 54-year-old age group, and actually the 18 to 34-year-old age group is more than half of deaths right now in this country. Now, of course, that's because that group only recently became eligible for vaccines. It's also because we're seeing greater hesitancy around getting vaccines among that age group. I mean, things like Joe Rogan's podcast last week telling people who are age 21 and healthy to avoid the vaccine is about the silliest thing that I've heard in a long while. That's why that age group is getting sick, is getting hospitalized, and is representing the majority of the deaths in our country right now.
Is there anything else we know about these young people who are getting it? Are they smokers? Are they morbidly obese? Do they have pre-existing conditions? You might not have that data, I don't know, but I'm just wondering, is there anything we know?
So we don't know a lot. So we know that if you're pregnant and you catch COVID, you are more likely to be hospitalized and to die than if you're a non-pregnant woman. We know, of course, that if you're obese, if you're a smoker, that also increases your chance. But I can tell you as an ER doc that I admit a lot of people to the hospital who have no pre-existing conditions, who are healthy 34-year-olds, 40-year-olds, 45-year-olds, got COVID, and a week or two later got bad pneumonia and had to get hospitalized. We're still waiting on the details about those recent deaths, but I suspect that we'll see the same thing, that there's just bad luck for some people, or there's some genetic trait that we haven't identified yet.
Today, the president of Moderna said that he expects that those of us who have been vaccinated, which I am a proud member of that group, will need to get an annual COVID booster shot. Why exactly is that? And is there a chance we could need boosters more frequently than annually?
So could we need it more frequently? Still TBD. The science on this virus keeps changing, but the reason for needing the booster is simply variants. As the globe continues to see spread of this virus, I know you're talking about India later in this show, that is a ripe space for variants to emerge. But even here in the US, there are states where only 20% of people are vaccinated. Every time the virus spreads, a new variant has the potential to emerge. And those variants can evade the vaccine-induced immunity. Now, let me be very clear, Jake, that the vaccines are better than natural immunity at protecting us against the variants that are currently out there. But as new variants emerge, it is likely that we are going to need those booster shots to help boost our immunity against the new strains that have developed thanks to continued spread of COVID across the globe.
And that's not just from Moderna. It's Moderna, Pfizer, J&J, any other, right?
That's correct. Yeah, that's a really important point, is it's not just Moderna. It's not because Moderna is somehow inferior. It's because of the virus continuing to change as it spreads.
So we know Republicans have been one of the main groups hesitant to get the vaccine, but a new poll by the Kaiser Family Foundation shows a number of Republicans who say they have gotten a COVID vaccine or intend to get one has increased 9% over the past month, from 46% in March up to 55% now. What do you credit for that increase?
So I think this goes back to that debate between vaccine hesitancy and vaccine confidence. We find there are a lot of people that aren't anti-vaccine. They aren't necessarily hesitant. They just didn't yet have confidence in the safety or the efficacy of the vaccine. As people see those around them get vaccinated, as people see that getting vaccinated gives you the ability to get back to normal, to take off your mask, to go on a cruise ship, to go to the movie theater, to go to a restaurant without worry. And as people see that getting vaccinated protects their community from getting sick, we're going to see more and more people be willing to show up and get vaccinated. So I think it's really just continued education, continued messaging. There was actually a recent study showing that if you tell Republicans that they can take their masks off after they get vaccinated, you see an almost 20% jump in the percent of Republicans that are willing to get a vaccine and arm. So those continued carrots are critical.
All right, Dr. Megan Ranney, thank you so much. Appreciate it.